Hello, my name is Fatu. I'm from the Gambia. Before knowing the condition that I had, I was losing weight and I lost appetite. So from there, I said to myself, this is not me and this is not normal. Then I got to go to Banjo. That was where I was diagnosed that I have mitral stenosis. And from there, I joined the cardiology hospital and I was going and coming until I reached where I am today. Then my government sent me to India, and when I came, I met with Dr. Varun Bansal.
Miss Fatu is a very pleasant 28-year-old girl who came to us with a diagnosis of severe mitral stenosis. One of her heart valve was very tight. It was also leaking, which was creating a lot of pressure on her lung. When we evaluated her lung pressures were 123, that is 123 millimeters of mercury, and her systemic blood pressure was 100 millimeters of mercury. In ideal normal scenarios, the lung pressures are less than 1/3 of blood pressures. But in her case, because of the valve problem, the lung pressures had gone up too high. Because of the heart disease, she could not do her daily activities. She was feeling breathless even while walking for short distances.
Where he told me the risks involved in my case, which he told me like 20% risks and 80% chances. So I didn't want to do it at first, but he told me that if I don't do it, my condition will get worse. Then I said, okay, it's fine. I will go ahead with it.
But thankfully, she put her trust in us in Apollo Hospitals, where everybody worked towards best of her health. We optimized her, admitted her one day prior to the surgery. She went through a very challenging phase when she was admitted to the ICU, got her surgery done, and was on ventilator for nearly 2 days. Even during her surgery, her heart was very weak. The valve was completely calcified. We changed the valve using a mechanical valve, which will last for her life if she continues to take anticoagulation with discipline.
After I did the surgery, now I'm fit. I can walk like a deer and I'm fit to go back to my country now. I'm feeling much more better.
Within 7 days, she was ready to be discharged, and nearly 2 weeks after, she is fit to go back to her family to lead an active life. We wish her best of luck and best of health, and we wish that she never has to come back to us for any kind of heart surgery again. Of course, she can come back for regular checkups and we'll be happy to help her and treat her.
Dr. Varun Bansal is very kind and very professional, and the nurses as well. Since I was admitted here, the nurses have been so kind. So the hospital is top-notch, their equipments are top-notch, world-class, and the hospital is just nice and the people are so friendly. From the doctors down to the nurses to the auxiliary staffs.